Hi everybody, April here. From the YouTube videos, one negative perception that I really noticed was that the rural patients sometimes were being viewed as like resistant to medical advice or not taking their health as seriously. That was when one of the patients wouldn't get surgery during, I think it was corn season. And this can lead healthcare providers to make assumptions that rural patients aren't willing to make those healthy changes, when in reality, they just might not have access to some of the resources that they need, or like transportation, actual support from a specialist that they might need, like a surgeon, or even in some cases, like access to internet for telehealth. So that would be a negative perception, in my opinion. On the flip side, the positive perception is the resilience, or like the self-reliance in a lot of patients. This was seen when a woman was willing to handle the birth of her fifth child. She's like, fifth one, got it. So while that can be really brave and seen as empowering, it is a positive perception, but at the same time, that can possibly make providers think that maybe they don't need as much help as maybe they do in that moment. So, I just think that that's really important, and it just might make, rural people's kind of unfairly judged in a lot of ways. So additionally, in my own words, health disparities, it's a measurable difference in health outcomes between groups. So, a rural area might have a higher rate of diabetes or lower life expectancy compared to urban areas. And health inequities, on the other hand, are unfair or kind of unavoidable differences. So those can lead to the disparities, like the lack of access to healthcare. So the two key differences between these terms are the what and the why, is kind of how I think about it. So disparities describe what is happening, or like the outcome, and inequities are describing why it's happening, so what the cause is. So disparities can be tracked with data using charts and tangible information like that, but then inequities are looking sort of at social and economic issues that could lead to them. So and understanding the difference between health disparities and inequities will shape my future career for sure. Understanding whether I'm working in nutrition or public health or any sort of health setting, making sure that I can understand why these assumptions are happening to people, make myself educated, I think is the first step. And then, making sure that by understanding those things, those don't influence my decisions on how I interact with people. So making sure I come out of a place of compassion and understanding is important to me, and I know that it would be important to whoever I'm talking with as well. So in general, compassionate care, staying educated, and making sure that through policy, connecting with patients, education, all of those things, you can be an advocate for the people that you're trying to support. So, bye.